Who's getting infected with COVID-19? Tonight, our NBC4I team breaks down new data that reveals how the virus is spreading based on occupation. Investigator Joel Grover shows us which workers are most likely to get infected.
You might think that hospital workers or grocery store clerks have the highest rates of COVID-19 infection. But it appears construction workers with no symptoms had by far the highest infection rate, according to this evaluation of people getting tested at LA's public sites, which has been submitted to this CDC journal. Are there surprises in this evaluation?
Yes.
Dr. Jeffrey Klausner of UCLA's School of Medicine was one of the authors of this analysis. It looks at 730,000 people tested at LA's public sites from August to October. Klausner is also medical director of Curative, which helps run the city's test sites, and did the evaluation. It found a high rate of positive test results among restaurant workers and healthcare workers, but construction workers, who sometimes resist county orders to wear masks, outpaced the other groups.
In the construction industry, people may still be coming to work if they have symptoms because there's no paid sick leave.
Other workers, such as personal care, were in a category called none of the above, which had a rate of infection comparable to grocery store workers, but far less than construction. Other findings of the report: men were more likely to get infected than women. And what might come as a surprise, people who reported having contact with strangers or being out in public places, such as outdoor dining or parks, had low infection rates. Do these findings tell you that outdoor dining or being at a park might be pretty safe?
Well, yes, and that's why I'm concerned, with public health interventions that push people indoors, that close outdoor venues, that close outdoor settings.
Klausner says the findings of the report indicate many people are likely getting infected by family members or co-workers that they're in close contact with. The evaluation found that more than 42% of people who came to sites like this one and tested positive had no symptoms at all of COVID-19.
One important finding we saw was that people who had been contacted by the health department and came in for testing, they had the highest frequency of infection. If the health department contacts you, go get tested.
For the I-Team, I'm Joel Grover.